Hello, welcome back. Doing a quick Facebook Live. Okay, so I'm going to get right into it. Got a couple questions today. And if you have questions after this, leave them in the chat, or I'm going to post this on my YouTube channel, Weight Medicine with Dr. Meghan. Happy to answer more. If this is your first time watching, welcome. I'm Dr. Garcia Webb. I am a board-certified physician in internal medicine, lifestyle medicine, and obesity medicine. And that's important because I actually prescribe these medications. I actually treat patients with overweight and obesity. I've helped hundreds of patients lose weight, and I'm here to help you too. So let me know what questions you have. I can't answer personal medical questions, but this is really a forum for education. So let me know what you have questions about. All right, so starting today, this was a question about the Mounjaro and Wegovy side effect hacks. Okay, what about antacids? What about them? Yes, you can totally use them. If I didn't mention that in the video, you can definitely take antacids. They will definitely help if you're having reflux. I highly recommend them. Pepsid is great. You can take it scheduled or as needed. You can also talk to your physician about something stronger that's a daily medication like omeprazole or pantoprazole, things like that. You can use both of them. I would definitely follow up with your physician if you're having reflux issues on the medications, and they'll probably have other great tips for you as well. But also sometimes the GERD gets better with time because as there's less abdominal pressure, there's less pushing back up the esophagus. So for some people, the GERD gets worse or doesn't change, but for some people, it does get better as they lose weight. Something to think about. Next question or comment. Okay, I didn't know what food noise was until I took Zepbound. I thought everyone's mind worked like that and had food noise. Oh, okay, yes. That is such a good point because food noise can be like very intrusive, kind of obsessive thoughts that people have, and it can really negatively impact the quality of somebody's life, and they just might not even fully notice it until it's gone. So in the same way, it's like if you had chronic knee pain and then all of a sudden you woke up and it's totally gone. Like, wow, this is how other people live, huh? It's pretty nice not having knee pain. So very similar. It's just in the background. You have it all the time. You think it's normal, but when it's gone, it makes a big difference. Absolutely. Absolutely. And I'm so glad that you are having that effect with the medication. Okay. Question about Mounjaro/Zepbound. Do you think this would help with smoking cessation? That is a great question. I don't believe there's any research about this yet. I have patients who quit smoking on this medication, but it wasn't like they started the medication and it became very easy to quit. So clinically, I don't have kind of great scenarios, although maybe it was easier overall. It would have been harder if they hadn't been on it. Hard to say, but I think because for some people there is such a significant effect on the reward system of the brain, that hedonic circuitry that's controlling the reward and what am I trying to say? That's controlling the kind of dopamine activity and that sense of like reward-based activity, because for some people it can really impact their cravings. I think it's a really interesting area to be explored. Smoking cessation, substance abuse, alcohol use disorder. I think those are all really going to see a lot of promising developments in terms of effects that these medications will have. I've definitely seen it for alcohol. Haven't seen it for smoking, but I wouldn't rule it out at all. Great question. Okay, next question. If I intermittent fast, will I lose muscle as well as fat? Yes. Anytime we lose weight, we are losing both muscle and fat. Usually we're losing about like 25% muscle. You can offset that if you're being really careful about protein. So talk to your physician about protein goals. If you go on the internet, they will tell you your protein goals are like a gazillion grams. That is not true. But talk to your physician about like reasonable protein goals. Also, strength training is really important. So if you don't want to lose muscle, build muscle. That's really important. Then you're going to be preserving your muscle mass as opposed to losing it naturally. That's going to happen regardless. I know there's so much that came out in the news in terms of like these medications causing like muscle wasting or all this stuff. But that happens with any weight loss, unless you're really working to preserve or build your muscle mass. So whether it's bariatric surgery, whether it's lifestyle changes, whether it's medication, whether it's all of those combined, just make sure you're getting enough protein and you're building muscle, and then you will not have to worry about that quite as much. That is a great question. Okay, this is a quick one today, but I just wanted to hop on and answer some questions, and thank you so much for watching. I will have the replay up on my YouTube channel, and if you have other questions afterwards, please let me know, but please be well. Otherwise, bye.